and we will start first with appendix. So what is appendix? क्या होता है appendix? इसकी definition I have already told you. Appendix shows the बोला था ना OGP याद रखने के लिए, origin, growth and progress of the homeopathic system of man in the mind of its author. That is the definition of appendix. So appendix means origin, growth and progress of homeopathic system of medicine in the mind of its author. That is the meaning of appendix. And इसमें क्या क्या है, कुछ कुछ important points है जो appendix portion में लिखे हुए हैं. So we will discuss those important points only. So homeopathy cures in anticism means it cures in advance. तो ये लाइन स्टेटमेंट वाले क्वेश्चन में आती है, क्योर इन एंटीसिज्म, इट इज डन थ्रू होम्योपैथी एंड इट इज कॉल्ड, दिस इज प्रिकॉशन, प्रिकॉशन एंड प्रोफाइलेक्सिस. क्योर इन एडवांस को क्या बोलते हैं? प्रिकॉशन एंड प्रोफाइलेक्सिस. मीन्स यू गिव वन मेडिसिन एंड इट इज प्रिवेंटिंग सर्टेन डिजीजेस. That is the meaning of cure in anticism. Then there are certain examples of cure in advance. So in the itch of wool workers, जो wool factory में लोग काम करते हैं, they suffer from itch. woolen में कौन सी itch spread करती है? Scabies. So Hahnemann is telling if those wool workers, they already carry sulfur powder in their pockets, so they will be protected against the infection of scabies. So this is one example of cure in advance, कि अगर वो wool workers अपने pocket में sulfur powder लेके पहले ही रखेंगे, so they will not suffer from the itch of scabies. Then another example he is giving, and we have already discussed this example, जो scarlet fever वाला example है. So for the prevention of scarlet fever, which medicine was used by Hahnemann? That was belladonna. So in the children who were not suffering from scarlet fever in the epidemic, they when took the belladonna, they were also protected from the scarlet fever. So these are the two examples for cure in advance given in appendix portion. Then Hahnemann's first homeopathic writing का नाम क्या है? Very very important. This is also the precursor of organon. Means organon आने से पहले जो आता है that is known as precursor. उसमें भी organon के बारे में कुछ starting है. That is why these are known as precursor of organon. So one precursor is essay on new principle for ascertaining the curative process, and it was published in 1796. तो ये year भी याद रखना है. And what are the precursors of organon? First is essay on new principle और दूसरा क्या है?
Medicine of experience.
Very good. So it is essay on new principle and medicine of experience. These are the two precursors of organon of medicine. ये दोनों चीज याद रखनी है. Then in essay on new principle, in this essay उन्होंने 24 examples दिए हैं of homeopathic cures in old school. So how many examples are mentioned in essay on new principle? 24 examples of homeopathic treatment done in old school. ये भी याद रखना है. Then another very important thing that is mentioned in appendix is Nenning symptoms. So ये Nenning symptoms का reference क्या है? 143 के footnote में देखोगे you will see 1A. So उसका additional portion, please mute yourself. इसका additional portion is given in appendix portion. So क्या है additional portion? Nenning symptoms. Nenning symptoms क्या है? To which Hahnemann was telling that he has proved certain medicine or he has provided with certain symptoms by paying to the prover. So Hahnemann is telling that Nanning ने क्या किया है, to the persons who are living at a long distance, जो दूर रहते थे लोग, उनको इन्होंने लेटर में लिखा that I will pay you money and you prove this medicine and write the symptoms of that medicine in the letter and you parcel that letter to me. So those symptoms are referred as Nanning symptoms as per Hahnemann. So Nanning के symptoms सबसे ज्यादा कौन सी materia medica में है? The Nanning symptoms will be found in large amount in the materia medica of Hartlaub and Trinks. This is very important. So Nanning symptoms सबसे ज्यादा किसकी materia medica में थे? In the materia medica of Hartlaub and Trinks. और Hartlaub and Trinks की materia medica का नाम क्या है? The name of this materia medica is also materia medica pura. So दो materia medica pura है, one it was written by Hahnemann and another was written by Hartlaub and Trinks. And in the materia medica of Hartlaub and Trinks were the Nanning symptoms. Very very important. Then Hahnemann ने chronic disease में क्या बोला है? That Nanning has furnished greatest number of symptoms which are given carelessly and in unprecise form. So what Hahnemann is telling about Nanning symptoms, that he has furnished means banana, he has produced a large number of symptoms and these large number of symptoms are given very carelessly, heedlessly and in unprecise terms, means these symptoms are not very well described. So that is the issue Hahnemann is having with Nanning symptom. And Hahnemann has selected only those symptoms that are fit for use. Although Hahnemann is telling कि ये सब careless symptoms है, well defined नहीं है, but फिर भी उन्होंने भी Nanning के कुछ symptoms select किए हैं. So कौन से symptoms which are fit for use? Only those symptoms जो उन्होंने देखा कि बहुत अच्छे से described है. In precise terms, they are described, only those symptoms Hahnemann has selected in the chronic disease. Then, in the preface of Magnesia carb in chronic disease, Hahnemann has given one name to Nanning, that is ever ready symptom manufacturer. ये क्वेश्चन आता है, ever ready symptom manufacturer किसको बोला है? It is the name given to Nanning. Where he has talked of this? In the McCarb chapter of his chronic disease. So all these points are very very important. So Nanning symptom first हमें कहाँ पे मिलेंगे? This is given as a reference to 143 footnote. And Nanning symptom सबसे ज़्यादा किसकी materia medica में है? Hartlaub and Trinks. Hartlaub and Trinks की materia medica का नाम क्या है? Materia medica pura. और किसने लिखी है materia medica pura? Hahnemann ने. Hahnemann ने क्या बोला है Nanning के बारे में? That he is furnishing the symptoms in large amounts and his symptoms are very carelessly and unprecisely described. Then, but still Hahnemann has selected certain symptoms from Nanning. Which symptoms he has selected? Which are fit for use. And what name he has given to Nanning? He is the ever ready symptom manufacturer. कौन सी मेडिसिन में लिखा है ऐसा? McCarb in chronic disease. So all these points which I have told you again, these are very very important. Then Hahnemann is saying that this proving is done in an indispensable manner. This is not very good proving which is done by Nanning, क्योंकि सारे symptoms बहुत ही carelessly described है. So Hahnemann ने बोला है कि क्योंकि our system is based on drug proving, so it should be done with very much honesty. ऐसे पैसे देके हम proving नहीं करा सकते. This is Hahnemann is telling about Nanning. And what is the short form for Nanning? NG. Wherever in whichever materia medica you will find written NG, तो वहाँ पे समझ जाना that this is the symptom which is given by Nanning. And what is R.E. Dudgeon telling about Hahnemann? He is telling that Hahnemann was very prejudiced for Nanning, कि वो मानने को ही तैयार नहीं है that Nanning has furnished good symptoms. Hahnemann is telling that he has furnished very bad quality of symptom. But Duggan is telling that Hahnemann is very prejudiced. That is why he is telling these things regarding Nenning. But what Duggan is telling, that his proving was conducted very conscientiously. बहुत अच्छे से उन्होंने प्रूविंग की है, बट हैनेमन ने जो मेथड फॉलो किया वो मेथड उन्होंने फॉलो नहीं किया, बट अदरवाइज उनकी प्रूविंग जो है दैट इज डन वेरी कॉशियसली, नॉट फॉलोइंग द मेथड ऑफ हैनेमन. हैनेमन का मेथड फॉलो नहीं किया, बट द प्रूविंग इज डन कॉशियसली. सो हैनेमन इज बीइंग वेरी प्रेजुडाइज्ड for Nenning. This is who is telling this? R.E. Duggan is telling this. कहाँ पे ये बोल रहे हैं? In the British Journal of Homeopathy. So in the British Journal of Homeopathy, R.E. Duggan is taking the side of Nenning. और किस किसने Nenning की साइड ली थी? Who else is supporting Nenning? First is your Herring and second is Bonninghausen. These two person also they are supporting Nenning. Why? Because Nenning की जो wife थी, Nenning की जो wife थी, उनका एक स्कूल था. She was running a school. She was running a girls school. और उसी स्कूल में इनकी दो daughters भी पढ़ती थी. So what Nenning is telling that मैं ऐसे symptom manufacture क्यों करूँगा? Because in this proving my wife and my daughters are also taking participation. So my symptoms are not manufactured symptom. और ये जो बात उन्होंने बोली है, this thing is ascertained by Herring and Bonninghausen also. So that is why they are taking the side of Nenning and they are saying that his proving is also done in a conscientious manner or it is done cautiously. These are not the manufactured symptoms. So all these things you have to remember regarding Nenning symptoms. Then dilutions beyond 30th potency. This thing is given in reference to 287 footnote number 2. Hahnemann ने क्या बोला है? 30th potency is best for both acute and chronic. Very important. ये line आती है. Which potency is advised by Hahnemann as a sufficient potency for acute and chronic disease? That is 30th potency. And this he has written in 246 footnote. And in chronic disease, what Hahnemann is telling, after you have given 30, then you have to decrease the potency. You have to give 24, 18, 12, 6 and so on. You have to come down. But हम लोग क्या करते हैं? After 30, we are giving 200. Then after 200, we are giving 1 m. Why? Because we are following Kent. So we all are Kent type of prescribers. But what Hahnemann was telling, that you have to reduce the potency. And in 1829, on 13th September, Hahnemann has wrote a letter to Dr. Schrader. ठीक है? And what he is telling in the letter, क्या बोल रहे हैं? कि ये जो आप potency बढ़ाते जा रहे हो, 30 के बाद 36 and then 60th. So he is not approving this increase in potency. Why? Because Hahnemann is telling we cannot go beyond or we cannot go up to infinity. ऐसे हम अगर पोटेंटाइज करते जाएंगे तो इन्फिनिटी तक पोटेंसी बन जाएगी. सो ही इज टेलिंग वी कैन नॉट गो टू इन्फिनिटी, वी कैन नॉट पोटेंटाइज सो मच. So there should be a standardized form. That is why he is telling up to 30 the potency should be made. This is told by Dr. Hahnemann regarding the potency. Then the precursors of organon we have already read. Essay on New Principle came in 1796 and Medicine of Experience came in 1805. Then what are the fundamentals or cardinal principle of homeopathy? You all know there are 7 cardinal principles of homeopathy. Law of similia, that is that which is similar to the disease symptoms, that medicine should be selected. Law of simplex, only simple medicinal substance should be given. Law of minimum, you should prescribe in minimum dose. Doctrine of drug proving, ठीक है, ड्रग प्रूविंग करके ही सारे symptoms note करके well known and well selected medicine should be given. Theory of chronic disease you should follow. You should follow the theory of vital force and doctrine of drug dynamization. These are the 7 principles which are followed in homeopathy. Then now let us start the aphorism portion. हमने last class में 145 तक कर लिया था and now we will start from 146. So 146 to 244 deals with the third point of business. हमने 3 points of business for cure पढ़े थे. First is the law of similia, second is the drug proving, and third is the how you will apply this knowledge of medicine to the knowledge of disease. So 146, this is again the repetition, third point of business. So what you have to do, you have to employ the medicines very judiciously. Okay, so there should be judicious employment of medicine to the cure, for the cure of natural disease. Then 147, very important. Why it is important? 147 में specific remedy बोला है. So question यही आता है, specific remedy is mentioned in which aphorism? It is mentioned in 147. And what is the specific remedy? It is the most suitable remedy which covers the maximum number of symptoms of the disease, or you can say totality of symptom के साथ मैच करने वाली जो सबसे ज्यादा मैच करेगी medicine, that is known as the specific remedy. Okay, the medicine that bears the greatest similarity with the totality of symptom. I am reading the line. So ये line हमें याद रखनी है. Specific remedy is that remedy which bears the maximum similarity to the disease symptoms, or you can say to the totality of symptom. That is the specific remedy. And हमारा motive क्या है? You have to select the specific remedy for a given case of disease. Then 148 is again the repetition of modus operandi. Modus operandi और कहाँ कहाँ पे mentioned है? In aphorism 29 and in aphorism 282 and in 148. So what is modus operandi? जल्दी से बोल दो जिसको भी याद है. किसी को भी नहीं पता what is modus operandi? Okay, I will also not tell because this is a very basic question. Next class में I will again ask what is modus operandi, and in next class I will ask your name. Then I will ask. सबका नाम बुला के I will ask, because modus operandi के ऊपर ही सारे organon और practice जो भी हम homeopathy करते हैं, that is based on modus operandi. So I will call your names and I will ask in next class. 149. What is 149 dealing with? Proper homeopathic medicine, patient recovers soon. So when homeopathic medicine is properly selected, then patient will recover in few hours to few days. In acute disease, ये important है. Acute disease में कितना time लगता है? When you give the proper medicine, few hours to few days. And in cases of disease of long standing, it requires proportionately longer time. ठीक है, थोड़े long time की disease है तो it will require a comparatively long time. And if it is a chronic medicinal dyscrasia, means the disease which is produced due to the allopathic medicines, such disease require much longer time and often they are incurable. So which type of disease these are? कौन से type की disease है ये? Which are
Artificial
incurable?
chronic disease.
Very good. These are artificial chronic disease, most incurable and most deplorable to cure. ये कहाँ पे लिखा है? कौन से aphorism में? Most incurable and most 75. Very good. और artificial chronic disease कौन से aphorism में mentioned है?
74.
Very good. So 74 is regarding the artificial chronic disease. 75 is the prognosis of artificial chronic disease. That means it is most incurable and most deplorable. And 76 is regarding the treatment of artificial chronic disease. तो तीनों aphorism 74, 75 and 76 they deal with artificial chronic disease. 74 में definition है, 75 में prognosis है and 76 में treatment है. So what is the treatment of artificial chronic disease? क्या करना चाहिए?
Ma'am, remedied by vital force itself.
Yes, very good. And remedied by vital force itself, and if there is any miasm in the background, then only you have to prescribe for the lurking miasm. Then इसके footnote में क्या है? Footnote deals with mongrel sect. What is mongrel sect?
Ma'am, mixing of
Very
physicians
good.
who mix allopathy with homeopathy.
Very good. So mongrel sect are the crossbreed dogs who practice both allopathy and homeopathy at the same time. So this is mentioned in 149 footnote. Very, very important. It is also discussed in 246 and it is also discussed in your preface portion. Then quid in Buccum venit. ये very important. बार बार ये क्वेश्चन आता है क्विड इन बक्कम वेनिट, ये कहाँ पे मेंशन है? 149 फुटनोट. ये नहीं आएगा तो इसका मीनिंग आता है whatever came to their mouth they have written. ठीक है, क्विड इन बक्कम वेनिट. Then 150 deals with indisposition, also written in footnote to aphorism number 7. aphorism 7 के footnote में भी है. What is indisposition? One or more trivial symptom. Trivial means बहुत ही minor symptoms which have started for a short period of time. जैसे कि कल रात से start हुआ है या आज सुबह से start हुआ है. So they have started for a short period of time and you should not consider it as a fully developed disease. So what is indisposition? It is one or more trivial symptom which have started for a short time and it should not be considered as a fully developed medical disease. Then what is the treatment of this indisposition? Slight alteration in diet and regimen will suffice to dispel such indisposition. अगर हम डाइट रेजिमेन में थोड़ा सा चेंज कर लेंगे तो ये इंडिस्पोजिशन चला जाएगा. दैट इज इफ यू रिमूव द एक्साइटिंग कॉज फॉर दिस इंडिस्पोजिशन द इंडिस्पोजिशन विल गो. जो अभी क्वेश्चन है इस एग्जाम में उसमें किसी ने एक्साइटिंग कॉज देख के आंसर क्या किया? एक्यूट डिजीज. सो एक्यूट डिजीज में सिर्फ एक्साइटिंग कॉज हटाने से काम नहीं होगा. व्हाई? बिकॉज एक्यूट डिजीज इज not always due to your exciting cause. Acute disease में exciting cause भी होता है. There is arousal of latent sore also. Acute disease में acute miasm भी होता है. And acute disease में हमेशा exciting cause से हटाने से disease नहीं जाएगी. कभी कभी medicine भी देनी पड़ेगी. But in indisposition, if you remove the cause of this disease, that is the exciting cause, then the indisposition will go. कैसे हम इसको हटाएंगे? जस्ट डाइट थोड़ा सा चेंज कर लो या फिर रहने सहने का थोड़ा सा तरीका चेंज कर लेंगे तो इंडिस्पोजिशन चला जाएगा. फॉर एग्जाम्पल आज सुबह मैंने कुछ ऐसा बाहर से खा लिया और पेट में दर्द हो रहा. अब मैं ज्यादा पानी पी लूंगी और कुछ कबाड़ा नहीं खाऊंगी और खाली पेट रह लूंगी तो इंडिस्पोजिशन चला जाएगा. जरूरी नहीं है उसके लिए दवाई लेना. सो इट वॉज ड्यू टू सम बैड प्रैक्टिस which I did for a short time. तो अगर वो bad practice हटा देंगे तो ये भी चली जाएगी. So that is why उस question का आंसर क्या था? Indisposition, not acute disease. Then 151, value of associated symptom. So if a patient narrate a few very serious symptom, जैसे कि acute disease में होता है, patient क्या करते हैं? जो उसके सबसे ज्यादा तकलीफ वाले सिम्टम होते हैं, मोस्ट ट्रबलसम सिम्टम, वो खुद ब खुद बता देते हैं. बट ऑन फर्दर इन्वेस्टिगेशन हमें क्या पता चलता है? देयर आर several associated symptoms also, although they are of slighter character, चाहे वो associated symptom बहुत ही slight उसको डिस्टर्ब कर रहा है, फिर भी यू हैव टू इन्वेस्टिगेट फर्दर. व्हाई यू हैव टू इन्वेस्टिगेट फर्दर? बिकॉज these associated minor symptoms or slighter symptoms, they will help in completing the disease picture and they will further help in the selection of a better medicine. Then 152 deals with anti-type of medicine. Worse of acute disease displays numerous striking symptoms. और बहुत ज्यादा मोस्ट सीवियर एक्यूट डिजीज जो है उसमें भी बहुत सारे स्ट्राइकिंग सिम्टम होंगे एंड बहुत सारे स्ट्राइकिंग सिम्टम्स होने की वजह से क्या होगा, you can select the medicine very easily. So even the severest of the acute disease will display a large number of striking symptom and इस केस में क्या होगा, you can select the medicine very easily क्योंकि बहुत सारे striking symptoms हैं. Then जो हम मेडिसिन सेलेक्ट करेंगे वो कैसी होनी चाहिए, दैट शुड बी अ एंटी टाइप, मींस दैट शुड बी अगेंस्ट द डिजीज सिम्टम्स एंड दैट इज द डिजायर्ड रेमेडी. सो एंटी टाइप क्या है, जो अभी हमने स्पेसिफिक रेमेडी पढ़ा है उसी का दूसरा नाम है. द मेडिसिन विच बियर्स द मोस्ट सिमिलैरिटी विद द डिजीज सिम्टम्स और द टोटलिटी ऑफ द सिम्टम, that is the specific remedy. So antitype and specific remedy are the same thing. So antitype is given in 152 and specific remedy is given in 147. And specific remedy और antitype is the desired remedy. वही medicine हमें select करनी है because उसको देने से ही patient ठीक होगा, because that is the most similar remedy. Then 153 very important, characteristic symptom. ये क्वेश्चन आता है, characteristic symptom are mentioned in which aphorism? 153. and क्या क्या हमें ढूंढना है, more striking, singular, uncommon and peculiar symptom. So characteristic symptoms कौन से symptoms होते हैं, which are more striking, singular, uncommon and very peculiar. And जनरल एंड अनडिफाइंड सिम्टम्स के कुछ एग्जाम्पल्स हैं यहाँ पे, ये भी पूछता है दैट लॉस ऑफ एपेटाइट इज अ कैरेक्टरिस्टिक सिम्टम या जनरल सिम्टम, तो आंसर होगा जनरल सिम्टम. भूख नहीं लगी, तो ऐसे ऐसे अगर कोई पेशेंट आके बोलता है तो क्या मेडिसिन सेलेक्ट करोगे, यू कैन नॉट सेलेक्ट अ मेडिसिन. व्हाई? बिकॉज दिस इज अ अनडिफाइंड सिम्टम. अगर बोलेगा कि सुबह में भूख नहीं लगती तो हमारे पास कुछ मेडिसिन हो सकती है, लॉस ऑफ एपेटाइट इन द मॉर्निंग, या फिर रात में भूख नहीं लगती तो यू कैन हैव सम मेडिसिन. सो इसको कुछ डेफिनेशन चाहिए, ठीक है, इट नीड्स सर्टेन मोडालिटीज, इट नीड्स सर्टेन कैरेक्टरिस्टिक्स. तो अगर उसमें ये डेफिनेशंस नहीं होंगे तो सच सिम्टम्स आर क्लासिफाइड अंडर जनरल एंड अनडिफाइंड सिम्टम. So what are the examples given by Hahnemann for general and undefined symptom? 3 example दिए, loss of appetite, headache, restless sleep, discomfort, etc. ठीक है, अगर ऐसे ही बोल रहा है कि सर में दर्द हो रहा है तो बहुत सारे मेडिसिन में है हेडेक का सिम्टम, रेस्टलेस स्लीप, डिस्कम्फर्ट. सिर्फ डिस्कम्फर्ट से यू कैन नॉट प्रिस्क्राइब एनी मेडिसिन. So this is regarding characteristic symptom and general symptom. तो क्वेश्चन में कुछ भी हो सकता है. characteristic symptom कौन से aphorism में है, general and undefined symptom. और ये चारों एग्जाम्पल याद रखने, ये क्वेश्चन में आते हैं. Then in the footnote of 153, Hahnemann is praising Bonninghausen and J.H.G. Jhar. Why? Because Bonninghausen has written this book Repertory of Antisoric, which deals with the characteristic symptoms of antisoric remedy. And handbook of principal symptoms ये लिखी है G.H.G. झार ने, इसमें भी मेडिसिन के बहुत कैरेक्टरिस्टिक सिम्टम है. देन Bonninghausen के बारे में he mentioned in 5th edition and in 6th edition he mentioned regarding G.H.G. झार also. तो 6th edition में देखोगे तो Bonninghausen और झार का दोनों का नाम है. अगर 5th edition देखोगे तो only Bonninghausen has been mentioned. Then 154 में again anti-type और specific medicine causes least disturbance in body. तो ये याद रखना है, कैरेक्टरिस्टिक सिम्टम कहाँ पे है? 153 में। 3 पे कौन सा लेटर आता है? एबीसी में सी आता है। सो कैरेक्टरिस्टिक 153 में है। कैरेक्टरिस्टिक के ऊपर भी एंटी टाइप है और कैरेक्टरिस्टिक के नीचे भी एंटी टाइप है। सो 152 also mentioned एंटी टाइप and 154 also mentions एंटी टाइप रेमेडी। तो ये याद रखना है, कैरेक्टरिस्टिक के पहले भी एंटी टाइप है और कैरेक्टरिस्टिक के बाद भी एंटी टाइप है। सो इफ यू गिव दिस एंटी टाइप और स्पेसिफिक रेमेडी तो इट विल कॉज लीस्ट डिस्टर्बेंस टू द पेशेंट, क्योंकि ये कैरेक्टरिस्टिक रेमेडी, सपोज आई हैव सिलेक्टेड अ रेमेडी ए एंड दिस इज द most similar remedy to the symptoms of the disease or totality of symptom, it is matching with these, so it will bring only the characteristic symptom which will cure the disease, क्योंकि ये सबसे ज्यादा उसके साथ मैच करती है डिजीज के साथ, so it will perfectly match with the disease picture and it will cure the disease without causing any disturbance to the patient. extra symptoms आएंगे ही नहीं, extra symptoms of the remedy will not come for the disturbance because it is matching with the disease very perfectly, because it is selected on the characteristic symptoms. Then 155, it deals with how cure takes place without any considerable disturbance. क्यों disturbance नहीं हो रहा है? Why? Because it is bringing only homeopathic part. ठीक है, जो मेडिसिन हमने स्पेसिफिक रेमेडी सेलेक्ट की है वो क्यों डिस्टर्बेंस क्रिएट नहीं कर रही? बिकॉज इट इज ब्रिंगिंग ओनली द होम्योपैथिक पार्ट इन द एक्शन वाइल क्यूरिंग, द रेस्ट ऑफ द सिम्टम्स डज नॉट कम इन टू प्ले। एक रेमेडी में कम से कम 3000-4000 सिम्टम हो सकते हैं, लेकिन हम वी हैव सेलेक्टेड बेसिंग ऑन द कैरेक्टरिस्टिक सिम्टम। हम 3-4 सिम्टम देख के प्रिस्क्राइब करते हैं, तो बाकी 3-4 हजार सिम्टम्स क्यों नहीं आते हैं? बिकॉज ये जो 3-4 बेस पे हमने सिलेक्ट किया, दोज आर द होम्योपैथिक सिम्टम्स, दोज आर द होम्योपैथिक पार्ट ऑफ द सिम्टम, और यू कैन सी द characteristic symptom. That is why there is no considerable disturbance to the patient. Then slight disturbance can be noted. Why slight disturbance can be noted? Because the medicine or the dose that you have selected, they cannot be exactly similar. Suppose this is the intensity of the disease and you have to select a somewhat stronger medicine. हमें जो medicine select करनी है वो natural disease से similar भी होनी चाहिए and it should be somewhat stronger. तो ये जो इतना part है ये strong part है इससे. So this strong part is causing a certain disturbance. So slight disturbance क्यों है? Because exact similar, हम लोग इसके ऊपर exact similar medicine नहीं बिठा सकते. It has to be a little bit stronger than the natural disease. So that is why there is a slight disturbance of the vital force. और इसको जब डिजीज चली जाती है तो वाइटल फोर्स अपने आप इस स्लाइट डिस्टर्बेंस को खत्म कर देता है. Then come to the next portion, that is 157 to 161. It deals with homeopathic aggravation. So apart from homeopathic aggravation और कौन-कौन सी aggravation होती है?
medicinal aggravation.
disease aggravation.
Yes, medicinal aggravation, very good, and disease aggravation. Medicinal aggravation में क्या होगा? The symptoms of the medicine will increase. ऐसे symptoms जो medicine के नहीं आने चाहिए थे वो वाले symptoms भी आ गए. And disease aggravation is the symptoms of the disease will aggravate. And homeopathic aggravation में क्या होगा? Only the existing symptom of the disease will aggravate, and those symptoms are also the symptoms of the medicine on which you have selected that particular medicine. So 157 to 161 very important regarding the homeopathic aggravation. 157 से लेके 160 तक acute disease aggravation and 161 deals with chronic disease homeopathic aggravation. So 157 in acute disease aggravation कब आएगी? What will be the time of aggravation in acute disease? So it occurs immediately after ingestion of the medicine. जैसे ही हम medicine खाएंगे in acute disease aggravation will start. क्या aggravate होगा? As I have already told, aggravation of his own disease. Disease के existing symptoms की aggravation हो जाएगी. But इसका time हमें याद रखना है. It is for first hours or first few hours. This is very important. ये line आती है. And unhomeopathic symptoms are not produced. Then homeopathic aggravation is due to primary action, and primary action is mainly due to conjoint action of vital force as well as the medicine. But if I say primary action is principally due to, then the answer will be
medicine.
yes, medicine only. It is principally due to medicine only. Medicine नहीं देते तो primary action होता ही नहीं. ठीक है. Although primary action is the combined action of vital force and medicine, but if I use the word principally, then it is due to medicine. Then Pierre Schmidt ने homeopathic aggravation के लिए कौन सा word use किया है? Rebound phenomena. Then 158 is slight homeopathic aggravation in the first hour is a very good prognostic sign. Continue. So a slight homeopathic aggravation अगर वो first hour में आ रही है तो that is a very good prognostic sign, especially in case of acute disease, because it is a sign that your medicine is acting. So अगर पहले घंटे में वो aggravation है then it is a very good prognostic sign. Then 159, if the dose of the selected medicine will be small, then the homeopathic aggravation will also be of a slighter character and it will also remain for a small period of time. So smaller the dose, smaller is the aggravation, slighter is the aggravation, and it will stay for a short period of time. Then 160 is the dose of homeopathic medicine can scarcely be reduced to such a degree as to make it powerless. इतना छोटा भी हम डोज को नहीं कर सकते हैं कि वो एकदम पावरलेस हो. थोड़ा सा एग्रावेशन तो होगा ही. द डिजीज एंड द डोज कैन नॉट फिट ईच अदर exactly. So homeopathic aggravation in the first few hours is must. And ये पहले ओल्ड स्कूल में किसने इस चीज को नोटिस किया है? Leroy and Lysons. These are the name of two physicians who have noticed that after the ingestion of medicine there is increase of symptoms. So these two names are very very important. Then first case of Hahnemann regarding the homeopathic aggravation. Hahnemann ने जो पहला केस देखा था homeopathic aggravation का, it was in the year 1797 and that was a case of colic or cholicodynia, that is the old term, and he used veratrum album. ठीक है, तो कोलिकोडाइनिया के केस में क्या मेडिसिन यूज की थी हनीमैन ने? वेरेट्रम एल्बम, and that was his first case of homeopathic aggravation and he saw it in the year 1797. देन 161 के दो एफोरिज्म है, एक फिफ्थ एडिशन का है और एक सिक्स्थ एडिशन का है. सो इन फिफ्थ एडिशन इट इज रिगार्डिंग द centesimal potency and in sixth edition it is regarding the LM potency. So it deals with homeopathic aggravation in chronic disease. तो कितने दिन तक aggravation चलेगी? In case of chronic disease, when you prescribe an antisoric remedy, then the aggravation will stay for 6, 8 और 10 days. इतने दिन तक aggravation चलेगी, 6, 8 और 10 days. और बीच के टाइम में क्या रहेगा? In the intervening hours there will be improvement of the patient. And इस 10 दिन के बाद the amelioration will start in an uninterrupted manner and the amelioration will stay for several days. So after the lapse of these aggravation days, 6, 8 or 10 days के बाद, the amelioration will come and it will be uninterrupted. And why in chronic disease aggravation is for a long period of time? Acute disease में सिर्फ 1 घंटे के लिए aggravation था, chronic disease में इतने दिन क्यों है? Why? Because in acute disease, disease is of severe character. Disease की जो इंटेंसिटी है वो बहुत ज्यादा है, इसलिए एक्शन ऑफ डोज एक्सपायर्स क्विकली इन केस ऑफ एक्यूट डिजीज। बट इन केस ऑफ क्रॉनिक डिजीज, डिजीज जो है लॉन्ग लास्टिंग है, ठीक है, इसलिए एग्रावेशन भी लॉन्ग लास्टिंग रहेगा और जो मेडिसिन हमने दिए उसका एक्शन भी लॉन्ग लास्टिंग रहेगा। सो दैट इज व्हाई द aggravation is shorter in case of acute disease and longer in case of chronic disease. Then 161 में क्या बोल रहे हैं कि chronic disease के treatment में if you do the treatment with the LM potency then it will be found at the end of the treatment. So at the end of the treatment, homeopathic aggravation will come in cases of chronic disease if you use 50 millisiemal potency or LM potency. And 50 millisiemal potency को Hahnemann ने क्या बोला है? Renewed dynamization. Renewed dynamization. और ये end पे जो symptoms आते हैं, what are those symptoms known as?
Sheehan syndrome.
Very good, very good. These are known as Sheen symptoms. These are known as Sheen symptoms. These are due to the excess of homeopathic remedy, which are seen at the case of at the end of the treatment of chronic disease. If you use 50 millisiemal potency for the treatment of the patient, and they are due to the excess of the homeopathic medicine. ये कहाँ पे mentioned है in the aphorism?
248. 248.
Yes, 248. Sixth edition बोलना बहुत
Sixth
जरूरी है.
edition.
Very good. 248 sixth edition it is being mentioned over there. So Sheen symptoms very very important. कब आते हैं? At the end of the treatment. कौन सी potency से आएंगे? 50 millisimal potency. So all these questions are important. Then next set of aphorism 162 to 171. What will happen if you have a smaller number of medicine? ठीक है, अगर हमारे चैम्बर में स्मॉल नंबर ऑफ प्रूव्ड मेडिसिन है देन व्हाट विल हैपन? फर्स्ट एफोरिज्म इज 162. इम्परफेक्ट सिलेक्शन ऑफ मेडिसिन विल बी देयर. अगर हमारे पास सारे सेट ऑफ मेडिसिन नहीं है, कम मेडिसिन है, तो व्हाट विल हैपन? इम्परफेक्ट सिलेक्शन ऑफ मेडिसिन विल बी देयर. व्हाई? बिकॉज यू हैव अ लेस नंबर ऑफ ड्रग्स. और ये वाले एफोरिज्म्स कब लिखे थे हैनेमैन ने? व्हेन the number of proved drugs was less. Number of proved drugs was less. लेकिन मैंने क्या बोला है? जब हमारे चेम्बर में कम ड्रग्स हो. क्यों मैंने ऐसा बोला है? क्योंकि अभी नंबर ऑफ प्रूव्ड ड्रग्स ज्यादा है. तो प्रैक्टिकली सिनेरियो क्या हो सकता है? हमारे चेम्बर में ड्रग्स कम है. सो इसलिए आई हैव चेंज द लैंग्वेज अकॉर्डिंग टू द सिनेरियो. लेकिन हैनेमैन ने ये बातें क्यों लिखी है? Because in the Hahnemann's time, in his lifetime, he has proved only 99 drugs. So that is why he has written these symptoms 162 to 171. So if you have less number of medicines or if there are less number of proved drugs, then first thing that will happen is imperfect selection of medicine. Why the selection is imperfect? Because जो भी हम medicine select करेंगे वो disease को बस थोड़ा सा ही कवर कर पाएगी. It will be partially similar to the disease, not completely similar to the disease. That is why this selected medicine is the imperfect selection for that particular disease. Then 163 is regarding accessory symptom of medicine. अब क्या होगा? ये जो medicine है, this is a partially suitable medicine and this is a inappropriate medicine. So इसकी inappropriateness की वजह से क्या होगा? कुछ एक्स्ट्रा सिम्टम्स आ जाएंगे, कुछ एडिशनल सिम्टम्स आ जाएंगे. सपोज दिस इज द डिजीज and this is the medicine you have. This is the medicine you have. So only this portion of the medicine is suiting with this disease. बाकी ये और ये तो मैच ही नहीं कर रहे. So this inappropriateness of the medicine will create certain accessory symptoms, and these accessory symptoms are the symptoms of the medicine. And why these accessory symptoms have come? Because of the inappropriateness of the medicine. but because of this partially suitable medicine क्या होगा, there will be a fair commencement of the cure, क्योंकि एटलीस्ट इतना पोर्शन तो डिजीज का ठीक होगा ना. सो दिस मेडिसिन विल एस्टैब्लिश अ फेयर कमेंसमेंट ऑफ क्योर. व्हाई? बिकॉज इसका जो सिमिलर पार्ट है, तो ये जो ये मेडिसिन है और ये डिजीज है, तो ये जो सिमिलर पार्ट है, ये इतने सिमिलर पार्ट को तो हटाएगा ही. सो इट इज बिगिनिंग अ क्योर by eradicating the similar portion of the disease. Then 164 selection based on characteristic symptom. लेकिन अगर ये जो हमने सिलेक्शन किया है, if this is based on characteristic symptom, ये और ये, this is disease, this is medicine, और ये जितना हमने पोर्शन मैच किया, if these are the characteristic portions, then cure will be established. ठीक है. अगर कैरेक्टरिस्टिक सिम्टम्स है, भले ही हमारे पास मेडिसिन कम है, बट इफ यू हैव सेलेक्टेड द मेडिसिन एंड दैट इज बेस्ड ऑन द कैरेक्टरिस्टिक सिम्टम, बाय चांस ऐसा हो जाता है डिजीज के जो सिम्टम्स है और हमारे पास जो अवेलेबल मेडिसिन है, द सिम्टम्स आर कैरेक्टरिस्टिक्स, देन एक ही मेडिसिन देने से क्योर विल हैपन. देन 165 सिलेक्शन बेस्ड ऑन कॉमन सिम्टम. लेकिन अगर क्या हुआ, कोई भी मेडिसिन जो भी हमारे पास है, उनमें से कोई भी मेडिसिन जो है वो डिजीज से सिमिलर नहीं है, देन व्हाट विल हैपन, यू हैव टू सेलेक्ट द मेडिसिन बेसिंग ऑन द कॉमन सिम्टम. और उससे क्या होगा, अगेन द मेडिसिन विल बी पार्शियली सूटेबल. So if in your store there is no medicine which exactly fits to the disease, or which is very much similar to the disease, or which is very much characteristic to the disease, then you have to base your selection on the common symptoms. और common symptom के base पे अगर selection करेंगे, तो again ये जो medicine है, that will only be partially suitable for that disease. Then 166 increased number of proved medicine. So हैंडमैन क्या कह रहे हैं, ऐसा imperfect selection हम इसको कैसे कम कर सकते हैं, if you prove more and more number of medicine. ठीक है, तो ऐसे सिचुएशन नहीं आएगी if you have more number of proved medicine. Then how to combat accessory symptom of the medicine, क्योंकि ये मेडिसिन पार्शियली सूटेबल है, सो इट विल ब्रिंग सर्टेन एक्सेसरी सिम्टम्स, अपने एडिशनल सिम्टम लेके आएगी. तो व्हाट यू विल डू टू इरेडिकेट दोज एक्सेसरी सिम्टम्स ऑफ द मेडिसिन, you will form again a new totality including these additional symptoms of the medicine. और फिर जो न्यू मेडिसिन आएगी, then you have to prescribe that new medicine. So how you will remove the accessory symptoms of medicine? You will form the new totality including these accessory symptoms of the drug, and you will select a new medicine for your further prescription. Then 168 search of medicine for new totality. ऐसे ही हमें बार बार न्यू टोटलिटी फॉर्म करनी है. जब एक टोटलिटी चली जाएगी, दूसरी टोटलिटी बनानी है, एंड बाय द रिपीटेड search, you have to do search and research for the medicine and you will accomplish the task of curing. ऐसे बार बार हमें accessory symptoms को लेके बार बार नया नया totality के बेस पे नया नया ड्रग हमें सेलेक्ट करना है, and then you will cure that particular disease when you have less number of proved drugs. Then कभी कभी ऐसा होगा कि दो मेडिसिन हमें इक्वली इंडिकेटेड लगेंगी. You will find both medicine A and both medicine and the other medicine B. Both of them you will find कि दोनों ही कैरेक्टरिस्टिक है, दोनों ही इक्वली इंडिकेट हो रही है. लेकिन इस केस में हमें क्या करना है, ओनली द मोर सिमिलर एंड मोर कैरेक्टरिस्टिक को ही हमें सेलेक्ट करना है. ठीक है. समटाइम्स यू विल फाइंड कि दो मेडिसिन दोनों ही इक्वली इंडिकेटेड है. सो इन केस में हमें क्या करना है, द मेडिसिन विच इज मोर कैरेक्टरिस्टिक और विच इज मोर सिमिलर. ये क्वेश्चन आता है, व्हाट विल हैपन व्हेन टू मेडिसिन्स आर इक्वली इंडिकेटेड, यू हैव टू सेलेक्ट द वन विच इज मोर सिमिलर टू द डिजीज. देन आफ्टर द एक्शन ऑफ फर्स्ट मेडिसिन इज एग्जॉस्टेड, देन हमें ऐसा नहीं है कि जो दूसरी मेडिसिन हमने सेलेक्ट की थी, सपोज ये A वाली more characteristic है and you have given this and now A का action जो है वो खत्म हो गया. The action of A is exhausted. तो ऐसा नहीं करना है कि second medicine जो आई थी you will give this second medicine. No. If this medicine is still indicated, then you prescribe this medicine. Otherwise, you do another fresh case taking, you make another totality of symptom and you select another medicine. ऐसा नहीं करना है कि पहली बार में हमने जो second medicine सोची थी वही medicine हमें next visit में देनी है. No, you have to again make the totality, again you have to select a new medicine. लेकिन अगर लगता है कि ये second medicine suitable है, totality उससे match करिए तो ही हमें वो second medicine देनी है, otherwise no. Then 170, second prescription after first medicine has affected the change. So same thing is written. जो हमने first medicine दी है वो क्या करेगी? It will remove certain part of the disease. Then again you have to do fresh case taking. You have to form a new totality and you have to do a fresh selection of medicine. And if by chance this second medicine, if it is still indicated, then you can give that second medicine. Otherwise, हमें बार बार new case taking करके करना है. अगर new case taking में second medicine आ रही है, तो give that. नहीं आ रही है तो go for another third medicine. Is that clear? इतना समझ में आया?
Yes, ma'am.
Okay. Then aphorism 171 deals with several antisoric in succession. ये question भी आता है. Several antisoric in succession. एक के बाद एक antisoric remedy देना. In cases of non-venereal chronic disease, that means in cases of psoriatic disease, you have to select several antisoric remedies. Because why? Because सोरा का जो मैनिफेस्टेशन है दैट इज वेरी इन अ वेरी वेरीड मैनर, बहुत ज्यादा उसको, इसलिए सोरा को नाम क्या दिया है? 1000 हेडेड मॉन्स्टर. इसके इतने वेराइटीज हैं, इट इज हैविंग वेराइटीज ऑफ मैनिफेस्टेशन. दैट इज व्हाई यू रिक्वायर द एंटीसोरिक रेमेडीज इन सक्सेशन. एक रेमेडी दी, उसके बाद दूसरी, उसके बाद तीसरी. सो यू रिक्वायर अ set of antisoric remedies in succession in order to establish a cure in cases of psoriatic disease. And when you will prescribe a new remedy, when the action of the previous medicine is completed, very important. So when you give antisoric remedies in succession, when the action of previous medicine is exhausted, then only you give the another antisoric. So ये खत्म हो गया when you have less number of proved medicine. Next set is dealing with one-sided disease. Very very important. 172 to 130 है one-sided disease, but there is some categorization of one-sided disease. So first classification is 172 to 174. इसमें है categorization of one-sided, internal one-sided, external one-sided. Then one-sided internal disease is 175 से 184. One-sided external disease is 185 to 203. 204 से 209 में है chronic disease. And one-sided mental disease, very very important, 210 से 230. 210 to 230. Then 172, too few symptoms. There are certain disease जो कि एक या दो symptoms produce करती है, which are having only too few symptoms. But here the Hahnemann is changing the condition. He is telling अब क्या है, disease के few symptoms है, but you have a good number of proved medicines. So what will be the scenario? We will read in further aphorisms. 173 is the definition of one-sided diseases. So very very important. One-sided disease are always chronic in nature and they are psoriatic in origin. ये question आता है, बार बार आता है. So chronic in nature and psoriatic in origin. ये दो point याद रखने हैं. What is one-sided disease? They have only one or two principal symptoms which obscure all other symptoms. एक या दो इसमें बहुत ज्यादा prominent symptom होंगे and these one and two principal symptoms will obscure or will cover all the other portions of the disease. हमें सिर्फ वो एक या दो ही symptoms ही दिखाई देंगे. These diseases are known as one-sided disease and they are less amenable to cure. You cannot cure them easily. क्योंकि एक या दो symptom होंगे तो you will be having a difficulty in selecting the medicine. So that is why they are difficult to cure, less amenable to cure. तो ये तीनों लाइन हमें याद रखनी है. Then 174 is the type of one-sided disease. There are two types of one-sided disease: internal one-sided disease and external one-sided disease. Internal में example याद रखना है: a headache of many years duration, a diarrhea of long standing, and ancient cardialgia. जो तीन लैंग्वेज में लिखा है वही हमें याद रखना है. Ancient cardialgia is an example of, ऐसे आएगा. It is an example of internal one-sided disease. Then external one-sided disease, इसका अलग नाम है, इसको बोलते हैं local disease. ठीक है, external one-sided disease को ही बोलते हैं local disease. Then 175 to 184 deals with internal one-sided disease. So 175 में क्या है? 175 में the disease is not really one-sided disease, but due to the physician's lack of investigation, due to the physician's fault in inquiring, the disease is looking as if it is a one-sided disease. Suppose हमें आलस आ रहा है केस टेकिंग करने में और क्या हुआ, एक या दो ही सिम्टम मिले. So you cannot consider this disease as a one-sided disease. Why? Because this is becoming one-sided due to your laziness, due to medical observer's want of discernment. He is not doing a proper case taking. He is not examining the patient properly. That is why he is getting only one or two symptoms. So such type of disease which is produced due to the fault of physician, you cannot call it as a one-sided disease. So पहले हमें अच्छे से केस टेकिंग करनी है. केस टेकिंग अगर प्रॉपर होगी तो पेशेंट भी सारे सिम्टम्स बताएगा. तो पहला जो हैनेमन ने बोला है कि अच्छे से केस टेकिंग करना है. So 176, even if after close inquiry, अच्छे से हमने केस टेकिंग कर ली फिर भी few symptoms हमें मिल रहे हैं. So this is the true one-sided disease, where even after close inquiry the patient is revealing only one or two prominent symptoms. ठीक है, and the cases are very few. There are few diseases which are true one-sided disease. ऐसा नहीं है कि बहुत large number of cases हमारे पास one-sided के आते हैं. There are few diseases which have even after most closest inquiry फिर भी उसमें एक या दो prominent symptoms है. Then 177 deals with selection of medicine in one-sided disease. How will you select the medicine in one-sided disease? So पहली condition जो बोल रहे हैं that is very rare condition कि ऐसा होगा these one or two symptoms are the characteristic symptoms of the particular medicine that you have selected. So इसमें क्या होगा, cure will be established. So if these one or two few symptoms, if they are most homeopathic to the case, then cure will happen easily. But ऐसा बहुत rarely होता है कि एक या दो symptom जो patient के हैं और एक या दो symptom जो भी medicine हमने select किए, they are characteristic symptoms. So cure will be established. But this is a rare scenario. 178 is when these few symptoms are characteristics. So already I have told you, अगर ये symptoms बहुत characteristics है, so cure will happen. Then 179, लेकिन ज़्यादातर cases में क्या होगा, this selection is based only on partially suited symptoms. क्योंकि एक या दो symptoms है, तो एक या दो symptoms पे हम भी जो medicine select करेंगे, that will not be completely suitable to that disease. Suppose this is the disease and this is the medicine. So only this portion is covered by the medicine. Why? Because we do not have a considerable amount of symptom. हमारे पास large amount of symptoms नहीं है. So basing on these 2 or 3 symptoms, you are selecting. So there will be a partially suited medicine that will be selected. And ज्यादातर जो होगा one sided में ऐसा ही होगा. You will select a partially suitable medicine. Then 180 is accessory symptom of disease. तो ये याद रखना है. 163 dealt with accessory symptom of medicine. 180 is dealing with accessory symptoms of disease. So what is accessory symptoms of disease? अब ये जो disease है इसके सिर्फ हमारे पास 1, 2 या 3 symptoms थे. Rest all symptoms are obscured by these 3 symptoms. Why? Because ये 3 symptoms जो है बहुत ज़्यादा prominent है और ये तीनों ही symptoms बाकी symptoms को बाहर नहीं आने दे रहे. They are not letting the other part of the disease to come to the surface. So what you have done? You have selected one partially suitable medicine. What this medicine will do? This medicine will produce some new symptoms. ठीक है, this medicine will produce some new symptoms, and these symptoms, what you will do, what you will call them, these are the accessory symptoms of the disease. Why? इसको disease symptom क्यों बोल रहे हैं? क्योंकि ये तो मेडिसिन देने के बाद आया, फिर भी इसको डिजीज सिम्टम क्यों बोल रहे हैं? बिकॉज मेडिसिन देने की वजह से ये सिम्टम बाहर निकल के आया. ठीक है, ऑल्दो दे आर कमिंग ड्यू टू द प्रिस्क्रिप्शन ऑफ दिस मेडिसिन, बट दे वर द पार्ट ऑफ द डिजीज, इसलिए वो बाहर निकल के आ पाए. इन 3 सिम्टम के पीछे बाकी सिम्टम्स वर हिडन, एंड दीज हिडन सिम्टम्स are let out by this partially suitable medicine. So ये question बहुत ही सावधानी से इसको solve करना है. You have to be very careful कि accessory symptom of disease पूछा है या accessory symptom of medicine पूछा है. medicine पूछा है तो 163 होगा, disease पूछा है तो 180 होगा. But how do the accessory symptoms of disease originate? They owe their origin to the medicine. मेडिसिन की वजह से ही वो आए हैं, बट दे आर द सिम्टम्स ऑफ द डिजीज. सो कीप दीज 2 लाइन्स इन योर माइंड. देन 181, न्यू मेडिसिन टू बी सिलेक्टेड कवरिंग द एक्सेसरी सिम्टम्स. अब क्या हुआ? पहले हमारे पास 1, 2 और 3 सिम्टम्स थे. नाउ यू हैव गिवन दिस मेडिसिन, and due to this medicine there is appearance of symptom number 4, symptom number 5, 6 and 7. Now you have to base your totality. अब हमें totality बनानी है basing on these 7 symptom. ठीक है, you have to form a new totality. And considering these symptom as a part of the disease, new medicine is selected. Now you have to select a new medicine. But one thing you have to be very clear about कि हमें ये नोटिस करना है कि कहीं ये सिम्टम किसी एरर इन रेजिमेन की वजह से तो नहीं आया, कोई इमोशनल डिस्टर्बेंस तो नहीं था पेशेंट को जिसकी वजह से ये न्यू सिम्टम्स आया, और दीज आर ड्यू टू सीजेशन और अकरेंस ऑफ द मेंस. किसी का मेनोपॉज या मेनार्की तो नहीं हुआ है, उसकी वजह से तो ये एक्सेसरी सिम्टम्स नहीं आया, और दिस इज ड्यू टू कंसेप्शन, किसी ने कंसीव किया, या चाइल्ड बर्थ. So all these conditions you have to keep in mind. अगर इनकी वजह से ये नहीं हुआ है तो this will be regarded as the accessory symptoms of the disease. Then 182, second prescription would be more accurate. अब क्या हुआ? हमारे पास number of symptoms has increased. Now the second prescription would be more accurate. Why? Because we have now more number of symptoms. Now you can select a more suitable remedy or more similar remedy. So this partially suitable medicine ने क्या किया? This imperfect medicine ने क्या किया? It has bring to the surface the undiscovered symptoms of the disease. जो symptoms of the disease hidden थे prominent symptoms के पीछे, इस imperfect medicine ने क्या किया? उन सारे symptoms को surface पे लेके आया. And due to the appearance of these symptoms, now we have a greater number of symptoms and we can select a better remedy. We can select a more suitable remedy. or more similar remedy. Then 183 very very important. क्यों ये important है? क्योंकि इसमें mentioned है status morbi. So status morbi is mentioned in 183. Now subsequent prescription to be done after the action of previous medicine is exhausted. Similarly जैसा कि हम less number of proved drugs में कर रहे थे, नई मेडिसिन तब देनी है when the action of previous medicine is over, तभी हमें न्यू मेडिसिन देनी है. एंड कैसे हम न्यू मेडिसिन सेलेक्ट करेंगे? बेसिंग ऑन द स्टेटस मोरबाई. व्हाट इज स्टेटस मोरबाई? करंट स्टेटस ऑफ द पेशेंट, करंट स्टेटस ऑफ द सिम्टम्स ऑफ द पेशेंट. उसके बेस पे हमें न्यू टोटलिटी बनानी है एंड न्यू मेडिसिन देनी है. न्यू मेडिसिन कब देनी है? व्हेन द एक्शन ऑफ प्रीवियस मेडिसिन इज ओवर. देन फुटनोट में क्या लिखा है? वेरी वेरी इंपॉर्टेंट. ये मुझे फाइनल ईयर के वाइवा में पूछा था. सो बिनम्ड स्टेट ऑफ नर्व्स की कंडीशन में क्या होगा? व्हेन द पेशेंट इज आउट ऑफ हिज सेंसेस, या फिर इतना ज्यादा इल है कि वो कुछ भी सिम्टम्स नहीं दे पा रहा, दैट मीन्स ही इज इन अ स्टेट ऑफ नम्बनेस. तब कौन सी मेडिसिन देनी चाहिए? सो यू हैव टू प्रिस्क्राइब ओपियम. व्हाई यू आर प्रिस्क्राइबिंग ओपियम इन सच पेशेंट्स? क्यों दे रहे ओपियम? Because opium is a narcotic drug and opium in its primary action takes away the sensibility and irritability of the patient, और secondary action में वो काम करती है. ठीक है. So इस बेस पे हम benumbed state of nerves की कंडीशन में you are prescribing opium. Is that clear?
Yes, ma'am.
Now 184, it is subsequent prescription is chosen for remaining portion of the disease. ऐसे ही बार बार हम जो भी portion of the disease हमारे सामने आएगा, you will again do case taking, you will again form new totality and you will give the new remedy. Then next is regarding the one-sided external disease. ये हो गया 175 से 184 one-sided internal disease. Now you have one-sided external disease or external type of one-sided disease. So इसका नाम क्या है? Local maladies. ठीक है. One-sided external disease को क्या बोलते हैं? Local maladies. The so-called local maladies are the changes and ailments that appear on external parts of the body. जो हमारे स्किन पे जो दिखाई देते हैं, those are known as local maladies. एंड जो ओल्ड स्कूल फिजिशियन है, दे आर कंसिडरिंग दैट इट इज अ स्किन ऑफ डिजीज ओनली, नॉट ऑफ द इंटरनल बॉडी. और इसी सोच की वजह से उनका जो प्रैक्टिस है, उनकी जो सिस्टम है, दैट इज द मोस्ट डिजास्ट्रस सिस्टम. So what Hahnemann is telling, this is not the disease of the skin only, it is the disease of whole body. But the old school physician are telling the opposite. वो लोग बोल रहे हैं नहीं, सिर्फ स्किन में डिजीज है, रेस्ट ऑफ द बॉडी इज फ्री फ्रॉम डिजीज. लेकिन ऐसा नहीं है. 186, व्हाट इज द डेफिनेशन ऑफ लोकल डिजीज? फर्स्ट पॉइंट इज इट इज प्रोड्यूस शॉर्ट टाइम बिफोर, थोड़े टाइम से ही हुई है, एंड इट इज सोलली बाय एन एक्सटर्नल लीशन. सपोज चाकू से मैं सब्जी काट रही थी, हाथ कट गया, तो दिस इज एन एक्सटर्नल डिजीज प्रोड्यूस ड्यू टू सम एक्सटर्नल कॉज. या फिर फ्रैक्चर हो गया किसी का. Such type of diseases are local disease, and rest of the body does not participate in the local disease. So अगर ये तीन criteria किसी भी disease में follow होते हैं, then it is a local disease. It is produced for a short time previously, solely by an external lesion, किसी external cause की वजह से हुए हैं, and rest of the disease does not participate in this disease. So such diseases are called as local disease. And in such cases, what you have to do? Surgery provides a mechanical aid. Suppose हाथ कट गया तो suture करना पड़ेगा, fracture हो गया तो plaster लगाना पड़ेगा. So surgery provides a mechanical aid for the removal of obstacle to cure. Example भी उन्होंने दे दिया. For example, reduction of dislocation. Shoulder dislocation हो गया, so you have to fix it back. Bandaging and sutures for wounds. So but in these cases also you can give your dynamic medicines. ठीक है, suppose cut injury हुआ है, you can apply calendula for the internal healing or for the reduction of pain. जैसे कि fracture हुआ है, you can prescribe symphytum. So like that you can give your dynamic medicine where whole body participate, या फिर whole body को उस local disease की वजह से अगर कुछ harm हो रहा है, जैसे फ्रैक्चर है तो बहुत ज्यादा पेन होगा, तो टू रिड्यूस दैट पेन यू कैन गिव योर डायनेमिक मेडिसिन्स. Then 187 deals with internal disease and external disease are interconnected. This is what Hahnemann is telling from the very beginning कि जो internal disease है और external disease है, they are interconnected. अब कौन से वाले external disease internal disease के साथ connected है? Which are not produced due to any external injury. Suppose किसी को skin में eruption हुआ है, eczema हुआ है, psoriasis हुआ है, ये सब इंजरी की वजह से तो नहीं होता है. बट ओल्ड स्कूल क्या कह रहे हैं? दे आर द डिजीज ऑफ स्किन ओनली, नॉट द डिजीज ऑफ होल बॉडी. सो दिस इरप्शन विच हैज अपीयर्ड ऑन योर स्किन, दिस इज नॉट ड्यू टू एनी एक्सटर्नल इंजरी. ठीक है, सो सच टाइप ऑफ डिजीजेज, Hahnemann is telling, such type of external diseases are connected with the internal disease. और अगर ऐसे डिजीज को हम लोकल ट्रीटमेंट देते हैं, उसके ऊपर कोई लोशन लगा लिया या फिर कोई क्रीम लगा ली या फिर उसका सर्जिकल रिमूवल कर दिया, so that is a medical absurd theory. This is a very wrong theory. To treat the local disease with local application or to remove it surgically, this is the most absurd theory. Then 188 deals with old school physician destroyed local maladies. लेकिन old school में क्या होता है? सपोज कोई वॉट हो गया तो उसका कॉटराइजेशन कर देते हैं या फिर उसको कट कर देते हैं. सो what they are doing, they are destroying the local malady. Why? Because they think this local malady is separate from the whole body. And Hahnemann is telling this is the biggest blunder of old school. ये उनकी सबसे बड़ी गलती है. Then 189 is telling that local disease is persisting due to internal disease. क्योंकि हमारे इंटरनल में कोई डिजीज है तभी हमारे स्किन पे ये इरप्शन रह सकता है. So what he is telling, no external disease can exist or maintain itself or grow itself without the participation of whole body. The whole vital force is involved. That is why this eruption is persisting in over your skin. So he is given the example of eruption of the lip, the whitlow or hangnails और पैरानोकिया. ये सब क्यों है? बिकॉज यू हैव सम इंटरनल इल हेल्थ, इसलिए बार बार लिप्स में इरप्शन हो रहा है. सो टू एग्जाम्पल has given eruption of the lip and whitlow of the nail. So this is again the concept of holism, means the whole body is involved, इसीलिए स्किन पे डिजीज हुई है. And concept of holism is also there in aphorism 15. So 189 and 15, that is 15, it deals with concept of holism. Then treatment should be for whole disease. ऐसा नहीं है कि स्किन पे डिजीज है तो सिर्फ ऐसे मेडिसिन सिलेक्ट किया जो कि स्किन के सिम्टम्स को कवर करती है. नो, दिस इज अ wrong theory. Your treatment should be guided towards the whole malady. That means it should cover both the internal disease as well as the external disease. और ये हमें कैसे करना है ट्रीटमेंट? बाय द मीन्स ऑफ इंटरनल रेमेडीज ओनली. कोई भी एक्सटर्नल ट्रीटमेंट अप्लाई नहीं करना है. सो द ट्रीटमेंट is through internal remedies and it should be towards the whole malady. Then 191 is internal medicine causes change in internal as well as external symptoms of the disease. So aphorism 191, it is telling that this internal medicine causes change in internal as well as external symptoms of the disease. जो हमने मेडिसिन खाने के लिए उसको दी है उसी से ही उसके इंटरनल डिजीज में भी इम्प्रूवमेंट होता है as well as the external manifestation, that is the skin eruption which is persisting over the skin, both of them are relieved at the same time, both of them are improved with the help of this internal medicine. तो मेडिसिन कैसे सेलेक्ट करनी है? लोकल सिम्टम के बेस पे प्लस द इंटरनल सिम्टम्स जो उसके हैं सबके बेस पे हम अगर मेडिसिन सेलेक्ट करेंगे, so this internal medicine will heal the body both internally as well as externally. Then what are the directions for forming the totality in case of local disease? So already I have told you, first you have to observe the exact character of the local affection. जो भी body में skin में eruption है या कोई भी eczema है कुछ भी है, you have to observe the exact nature of that local affection. Then पेशेंट के हेल्थ में क्या चेंजेस हैं, क्या सफरिंग्स हैं एंड द सिम्टम्स, मीन्स प्रॉपर केस टेकिंग जिससे हमें उसके इंटरनल कंडीशन के बारे में पता चलेगा. एंड बिफोर टेकिंग द मेडिसिन व्हाट वर द सिम्टम्स, ठीक है, व्हाट वर द सिम्टम्स विच मे हैव बीन प्रीवियसली नोटिस्ड व्हेन नो मेडिसिन हैड बीन यूज्ड. अगर वो कोई मेडिसिन लेने के बाद हमारे पास आ रहा है तो मेडिसिन लेने के पहले क्या क्या सिम्टम्स थे, व्हाट वर द सिम्टम्स which persisted before the application of any other remedy, so those also you have to collect. So this is how you will form the totality in case of local disease. सबसे striking symptom इसमें क्या है? The local affection. This is the most striking feature of local malady. ये question आता है. Then 193, cure of internal as well as external disease by administration of internal medicine alone. So it is again the repetition of the previous one. अगर हम internal medicine देंगे तो you will cure the internal as well as external disease. और इससे क्या पता चलता है? That this external manifestation or this external symptom was डिपेंडेंट ऑन इंटरनल डिजीज, इसलिए इंटरनल मेडिसिन देने से एक्सटर्नल सिम्टम भी चला गया. सो दिस इज द प्रूफ दैट द एक्सटर्नल सिम्टम इज बेस्ड ऑन द इंटरनल डिजीज एंड दिस एक्सटर्नल सिम्टम आर द स्ट्राइकिंग सिम्टम्स, ये याद रखना. Then 194, administration of external or simultaneous administration of internal as well as external remedy is not permitted. So for any local disease or any external manifestation, you cannot administer external remedy. This is not permitted. या फिर internal and external remedy both together are also not permitted. So external remedy not allowed and both internal and external remedy are also not allowed at the same time. So what he is telling, चाहे acute disease है या फिर chronic local disease है, in both of these cases it is not beneficial to apply any medicine externally. कोई भी हमें लोशन वोशन कुछ भी लगाने के लिए नहीं देना है in cases of any skin manifestation. This is not beneficial for the suffering patient. What you have to do? You have to prescribe a medicine from the general store of medicines or non-antisoric medicine you can say. So you have to pick up one remedy from the general store of proved medicine. What is general store of proved medicine? Medicine which are non-antisoric. And क्या हुआ? अगर फिर भी ये जनरल स्टोर ऑफ प्रूव्ड मेडिसिन देने के बाद if still after prescribing the non-antisoric remedy there is some part of the disease which remains, then you have to understand that it is depending upon the sore and then you have to give the antisoric medicine. तो अगर बाद में एंटीसोरिक रेमेडी देनी है तो पहले से क्यों एंटीसोरिक नहीं दी? Why at the first we are not giving antisoric? Because at
Because these
बोलो because
मे बी क्योंकि ये वन साइडेड डिसीजेज है और बहुत कम लेस सिम्टम्स है और वी डोंट नो द एग्जैक्ट कॉज ऑफ द डिसीज और प्रॉपर केस हिस्ट्री नहीं है इस वजह से।
no why because this is dependent on sora one sided disease किस पे बेस है it is due to soric origin so अगर हम पहले से ही एंटीसोरिक रेमेडी दे देंगे जो लेटेंट सोरा है यू विल अराउज दैट लेटेंट सोरा ठीक है हमेशा ऐसा तो नहीं होगा कि जनरल स्टोर देने के बाद ठीक नहीं होगी डिजीज सर्टेन डिजीज विल यील्ड टिल दिस स्टेज ओनली ये वाली रेमेडी देने से ही वो ठीक हो जाएगी and if in the very beginning you are giving the antisoric then you will make the patient in trouble तो उसका सोरा पूरा अराउज हो जाएगा दैट इज वाई पहले हम जनरल स्टोर से या नॉन एंटीसोरिक रेमेडी दे के उसको ठीक करने की कोशिश करते हैं बट स्टिल ही हैज टोल्ड ना इफ देर इज अ रेमिनेंट ऑफ द डिजीज पूरी डिजीज तो नहीं रहेगी अगर रिमेनिंग रह जाती है सो दैट मीन्स सोरा जो है दैट इज स्ट्रॉन्ग और इट हैज नाउ अराउज्ड वो लेटेंट स्टेट में था और अब वो इट वाज एट द वर्ज ऑफ डेवलपमेंट इसलिए हमने बाद में एंटीसोरिक दिया so that is why in the very beginning you cannot give antisoric because certain diseases will yield with this non-antisoric medicine they will be cured with these non-antisoric medicine so there is no use of unnecessarily arousing the dormant sora. Then what are the examples he have given regarding the general store of proved medicine? चार example दिए हैं एकोनाइट, रस्टॉक्स, बेलेडोना and mercury. 194 general store of proved medicine aconite, rustox, belladonna and mercury. Then 195 antisoric treatment for the relic of the disease. For the remnant portion of the disease, you have to give antisoric treatment. Then 194 and 195 aphorism. These two aphorism they came for the first time in fourth edition. First, second और third edition में 194 और 195 नहीं है. They came with the introduction of theory of chronic miasm in the fourth edition. So 194, 195 they came in fourth edition along with the theory of chronic miasm. Fourth edition कौन से year में आई है?
1829।
Very good. And chronic disease was discovered in which year?
1828।
वेरी गुड सो इसलिए क्रॉनिक माइजम के डिस्कवरी के बाद फोर्थ एडिशन वाज पब्लिश जिसमें थ्योरी ऑफ क्रॉनिक माइजम वाज एडेड एज वेल एज दीज एफोरिज्म्स वर आल्सो एडेड देन 196 कभी कभी हमें क्या लगेगा that if you give both internal as well as external remedy at the same time the cure will be fastened or the cure will be hastened ऐसा लगेगा कि जल्दी से ठीक हो जाएगा इंटरनली भी दे दो और बाहर से लोशन लगाने के लिए भी दे दो ऑइंटमेंट लगाने के लिए भी दे दो तो जल्दी ठीक हो जाएगा सो दिस मेथड इज नॉट करेक्ट बिकॉज इट इज हैविंग सर्टेन डिसएडवांटेजेस व्हाट विल बी द डिसएडवांटेजेस द लोकल सिम्टम्स विल बी गोइंग अर्लियर देन द इंटरनल डिजीज और हमें लगेगा कि इंटरनल डिजीज भी ठीक हो गई why because this local disease was persisting due to the internal disease but if due to the application of the external ointment or externally the application of any lotion what it will do it will take away the local symptom quickly and you will be misguided as if the whole disease is cured. So this is the major disadvantage of removing the local symptom. Moreover, this local symptom is the chief guide for the selection of the medicine. और अगर हम इस chief symptom को ही हटा देंगे, then you will be misguided that the internal disease is also cured. So that is why you should not give both external as well as internal remedy at the same time. Then 198, local symptoms are the chief guide for selection. Same thing which I have already told you. If you remove that local symptom, then no peculiar symptom will be there to prescribe upon. क्योंकि ये local symptom बहुत ज़्यादा characteristic था और उसी को ही अगर हम remove कर देंगे, then there will be no characteristic symptom to be prescribed upon. Then 199, destruction of local symptom makes the selection more difficult. So if you remove the local symptom by topical application like your lotions and ointments, or with the help of knife if you cut them, or you burn with the help of cauterization, then the selection of the remedy will be very difficult. Why? Because the main symptom, that is the main striking symptom, that is the local symptom, that has been eradicated by you. So the selection of remedy become most difficult. Then what is the advantage of local symptom? इस local symptom के persistence का advantage क्या है? It is a guide, or you can say it is an evidence. ये एक सबूत है that your internal disease is still persisting. So it is an evidence for the persistence or existence of your internal disease. And till it is maintained on the surface of your skin, it means that the internal disease is not fully eradicated. तो जब तक local symptom present है skin पे, तब तक हमें ये नहीं सोचना है कि internal disease जो है वो ठीक हो गई है. So this is the advantage of the persistence of local symptoms. Then 201 is internal disease is transferred as local disease. So this is the vital force who is transferring the internal disease to the external surface, so that कोई vital internal organ जो है वो damage ना हो जाए. Suppose there is a disease of the heart which is planning to start inside your body. Body में कोई heart की disease start होने वाली है. So what vital force will do? Vital force, instead of damaging the heart, it will transfer the disease to the external or less important part, that is the skin. So this is a type of protective mechanism which vital force is using for silencing the internal disease. Internal disease को थोड़े time के लिए silent रखने के लिए vital force क्या करता है? It is transferring the internal disease in the form of local disease to the skin. This local symptoms neither cures nor diminishes. अब ऐसा नहीं है ये लोकल सिम्टम अपने आप ठीक हो जाएगा या अपने आप कम हो जाएगा. बट व्हाट इज दिस लोकल सिम्टम? दिस इज अ सब्स्टिट्यूट फॉर द इंटरनल डिजीज. ये हमें बता रहा है कि इंटरनल कुछ डिजीज होने वाली है, जल्दी से go for a treatment. So as the internal disease increases, so does this local symptom also increases. जैसे जैसे हार्ट की तकलीफ बढ़ती जाएगी वैसे वैसे the eruption over the skin will also increase. And in the footnote what he is telling, जैसे कि old school physician क्या करते थे? They were applying issues for the treatment of epilepsy. They were thinking that the epilepsy is due to excess of blood in the brain. तो ऐसे एक होल किया ऑक्सीपिटल रीजन में और एक थ्रेड वहां पे लगा दिया. अब उस थ्रेड के थ्रू द ब्लड इज कमिंग. दिस इज नोन एज इशू एंड दे थॉट दैट एपिलेप्सी ठीक हो जाएगी. But this does not cures that epilepsy, because epilepsy is the internal disease. So due to the application of this issue is an external treatment. It does not help in the cure of internal disease. Then 202, destruction of local symptoms arouses the internal latent disease. So the more you destroy these symptoms, the more lotions or the more ointments you prescribe, the more the internal disease will be aroused. The latent sora will be aroused more. So इसलिए surgical removal किसी भी external symptom का नहीं करना है. Then 203, destruction of local symptoms causes production of innumerable forms of chronic disease. So already I have told you, the more you remove the external symptom, the more the internal disease develops. और किस form में वो develop होगी, we cannot know. So it is a very dangerous method to destroy the external symptom or the local symptom or the local malady, which is a substitute for the internal disease. So what Hahnemann is telling, this is the most criminal procedure. ये जो removal of external symptom है, this is the most criminal procedure of which the medical world can be guilty. So this completes your today's class, and if you have any doubt, you can ask me after going through this lecture once again.